All right. Good morning. Um, there's no better time to start this than now, so I'll just get straight into it. Welcome to one of our mini series where we'll be discussing some infectious diseases and try to uh, make people understand more about them so that they can take informed decisions. So we'll be starting with respiratory system infections, and the reason for that is because of number one, the materials I'm using. I'm using Nesta's Microbiology Human Perspective textbooks. It is a better alternative than coming up with my own PowerPoint presentation, as it would allow people to, if they can get the textbooks on their own, or they can follow the information that will be displayed. Also, it's actually an ideal start because we're dealing with respiratory infection currently in the whole world, the pandemic, COVID. So more or less a good place to start. So for this topic, we'll first analyze and go through respiratory system so that we'll be able to understand how infection comes to be. Sorry about the image. Of course, when we're discussing infection, we'll be coming across all sorts of images that may be, just they are the reality of the disease we'll be talking about. So you may have to learn to cope with it. So let's just get to it. So the stuff about respiratory infection is that it's one of the they are one of the major infections that the body experiences during their course of living, and we have these infections ranging from the mild ones then to extremely complicated ones, and of course these are majorly based on the fact that we have what we refer to as the upper respiratory system, and then we have what we refer to as the lower respiratory system. So most of the time, the diseases that affect the lower respiratory system are usually much more serious than the one that affects the upper respiratory system, though the one that affects the upper parts might eventually get to the lower parts and also cause some sort of life-threatening diseases. But before we can go into all those, let's quickly look at the anatomy, the physiology, and the ecology of the respiratory system, so that you will be able to put in perspective by the time we're discussing all the issues that are affecting the entire system, and you'll be able to understand more about the infection. Now, the major the major function of the respiratory system is the exchange of gases, the taking in of CO2, and should I call it the exiting of, the taking in of oxygen, and then the exiting of carbon dioxide. So, and in addition to this, we have the respiratory system is also responsible for the production of sound and the detection of odor, smell, and the likes. So we have a lot of parts, of course, like I said, the upper respiratory tract and the lower respiratory tract. So we'll start with the upper respiratory tract, and let's quickly put it on note here that although they are not part of the respiratory tract, the eyes and the ears are also included. As we go along, we are going to see why, because they are also part of the organs that are affected during respiratory infections. Also, the mouth is also an opening to the respiratory system, so we'll also be talking about it as well. So let's discuss the upper respiratory tract. The upper respiratory tract consists of the nose, the nasal cavity, the throat, and the epiglottis. And most of this, all the part of this this system are covered in what we call a mucus. Now, these mucus are extremely very important in the protection of the respiratory tract, and they trap dust, they trap organisms, and find a way to kind of eject them from the respiratory system. So they are produced by the goblet cells, and these goblet cells are lined across the entire cells of the membrane covering the respiratory tract. So, okay, there's another thing to note here. This entire mucous membrane have what they call cilia. These cilia are like, should I call them tiny projections that usually move in the same direction. So what this does is to what this do, because there are many, they are not just one. The plural of the singular term for cilia is cilium. So what this do is to push the mucus continuously from way down below to the upper parts, and eventually that's why you are able to split out mucus from your mouth or from your nose. It's a way of, it's one of the crude defensive mechanism of the respiratory tract. And you can see what they said there. Eventually the entire process is called mucociliary escalator, and it keeps the lower respiratory tract free of microorganisms. But unfortunately, smoking, alcohol, and narcotic abuses, and also by infection, affects cilia movements and increases the chance of infection. As we go along, we're going to see more about how those things affect them. So we also have the tonsils. Tonsils, they are a source of, should I call them, one of the primary immune response in the respiratory tract, but they also are prone to infection, and they result in tonsillitis. So let's go through this. Okay, we talk about the nose and the nasal cavity. Of course, we know that the nose, the primary aim of the nose is to eventually take in here. Take in here, and the air eventually gets into the lungs, where the gaseous exchange happens and then gets circulated through the whole system. So I'll be skipping most of this so that we won't take much time there, because I still want to go through the images. Okay, then we now have the pharynx, the throat, that's another name for pharynx, then the epiglottis. So most air being taken in by the nose pass through the throat, pass through the pharynx, and because of that, the pharynx is also one of the organs that come directly in touch with the air when you inhale them, which also opens them up to infection. And of course, when that infection happens, which is the inflammation of the throat, we have what we call a pharyngitis. Okay, so let me see. Okay, this is the overall image. Of course, it's a lot, but as you can see at this upper part, you can see the cilia, you can see the projection there, you can see the mucus You can see the goblet cell producing the mucus. You can see the direction of the cilia. The flow of the mucus is going towards the upper part. So what they do is to sweep the mucus directly towards the nose or towards the mouth where they are injected. So, and oh, sorry about that. Okay, so these are the infections. These are the group of infections that can happen at the upper respiratory part. We have adenoviral, pharyngitis, common cold, diphtheria, ear infection, epiglottitis, laryngitis, streptos, tonsillitis. These are majorly mild infections that usually happen at the upper respiratory tract. And you can see the location of most of this. This is the larynx, this is the epiglottis, this is the pharynx, and then this is the tonsil. Okay, this is the larger aspect of larger image showing the respiratory tract, the upper part and the lower part. The lower part, okay, let me quickly talk. Okay, this is the bronchioles, the alveoli, the capillaries, the arteries. The stuff about the lower part is that it's very complicated. They are majorly for gaseous exchange. That's where their own work is. What they call it, where the air taken in, the oxygen being taken in, where they are mixed with blood and where they are being carried out of the lungs to the other parts of the body. And we have tons and tons of infections that can happen there. You can see bronchiolitis, bronchitis, it's actually a lot. Tuberculosis, respiratory syncytial infection, pneumonia, influenza. Of course, recently we've added COVID-19 to it. So it's the infections of the lower respiratory system are very, very, very serious and at times life-threatening. So, okay, now, of course, if you remember very well, we mentioned during this issue of COVID-19, there are a lot of issues about you not touching your eyes with your hands. And I think a lot of people now have an idea that the eyes is also an entry point into the respiratory system. So it's not complicated. It's because of the connection within between the eyes and the one and the nose. Now you can see what this place is. The tear ducts connect the eyes to the nasal chamber. So that simple connection can actually take in any microorganisms and take them to the respiratory system through the eyes, and also through the ear. Through the ear, we have under roots where microbes can enter the respiratory system, and that's the middle here. It links with the what they call it, the pharynx, in what we call the nasopharynx, nasopharyngeal tubes and the likes. So, in a way, we have this interconnectivity between the eyes, the nose, and the ear that can eventually lead to the infection of the respiratory tract. Okay, so of course, the image above I've already shown the lower respiratory tract, and of course we've already said it contains of the larynx, that's the voice box, the trachea, the bronchi, and the lungs. We have the inflammation of the larynx as laryngitis, and bronchi as bronchitis. And we have the one, in fact, the bronchi branches into what we call the bronchioles, and we have the infection of those ones called the bronchiolitis. So, in some instances, we have fluid filling the alveoli. Of course, the fluid is filled with pus and mainly pus as a result of inflammation, as a result of infection, and then that results into pneumonia. So, let's, of course, okay, let me quickly address this. There are some parts of I've discussed this earlier a long time ago about normal microbiota, the normal residential microorganism of the body. So in a way, these microorganisms, they are referred to as microbiota, and though expectedly the one that comes in direct contact with the environment are expected to have some organisms that are residential there, like the nasal cavity, the nose, even though they are being continuously expunged, but they are still there. So it is expected that there will be some parts of the respiratory system that are completely sterile. It is expected to be. The lower respiratory tracts are supposed to be completely sterile. In fact, they are sterile. They don't have any normal microbiota. They are not supposed to have it. The occurrence of any microorganism, finding a microorganism in the lower respiratory tract talks of infection, and it's not actually a good thing. So that's about the introduction to the anatomy of the respiratory tract. And okay, the ones I just mentioned the ones I mentioned about the sterility of the respiratory tract, to talk about the ecology. Of course, the major parts of the upper respiratory parts they are mostly colonized with some harmless microorganism, but even this harmless microorganism should not get to the lower respiratory tract, so that it won't cause a major issue. So let's quickly now go to the bacterial infection of the upper respiratory system. I'll just quickly speak about the first one, then we'll be able to, we'll call it, we'll stop there so that you'll be able to get into much more detailed discussion later. So the first one we'll be talking about is streptococcal pharyngitis, which is commonly referred to as strep throat, or as we know, they call it sore throat. Now, sore throat is a very common infection, not only in the United States as written here, but also in Nigeria. We are always treating sore throats either by taking local herbs or by going to the pharmacy to complain and get what's this thing called strepsil, something to just relieve the throat. It's always very painful. It's a painful infection, and most of the time it's it can lead to a lot of inconvenience and discomfort. So let's quickly look at the signs and symptoms of streptococcal pharyngitis, strep throat. Now, of course, you have sore throats. That's the name, which is it's going to give you a lot of difficulty in swallowing of food, even liquid. In fact, most times when you are having strep throats, you are usually taking pap, hot pap as one of the remedies. So, but the symptoms include very sore throat, painful, Then the throat is red. Then we have pores in some part of it. Then the lymph node are enlarged. If you check, if you press a part of your neck towards the Adam apple, you realize that okay, there's a place there that is a little bit bigger than the rest of the body. Then okay, the abdominal pain and headache. Of course, headache is always there. The abdominal pain might not really be obvious in most people. Then, of course, it doesn't usually comes with a cough. It doesn't usually come with a cough. It doesn't have, there's no running eye, no weepy eyes, no running nose. In some instances, some people recover by themselves, but the problem is that the pain, the discomfort always pushes us to, they push us to quickly get a solution for it, because it's not as fun as being written here that mild symptoms. That thing doesn't have mild symptoms. That thing is painful. So of course, the causative agent is Streptococcus pyogenes. It's an organism that's have a lot of similarities with most Streptococcal family. I don't want to dwell much on that. I want us to go to other. Is it okay? Okay, let's do it this way. Let me quickly get to all this information so I'm not actually necessary. Okay, yes. Let me go talk about the epidemiology. Of course, the strep pyogenes actually affects humans, and they spread by respiratory droplets. Of course, most respiratory infections are spread by droplets. When somebody sneezes, and somebody talks, and somebody ejects air forcefully from the mouth or the nose, and somebody else kind of inhale it. And of course, it can also be spread through food contamination. Don't forget, we said that the throat, the mouth has a connection with the respiratory system. So the mouth also have a connection with the throat, the pharynx. So once you take in food contaminated with that organism, you get it's likely you get the infection, you contract the infection. So now, the S. pyogenes might not really cause any known symptomatic infection in some patients, depending on the association they have with the immune system. So the immune system, together with the immune system, they might be occurring in a state of balance, like equilibrium. So keep them at bay from actually becoming symptomatic. But these people are, how can I call them? They are carriers. So even if they are not showing any symptoms, they can transmit to the other person. So and usually through talking. Yeah, and the problem with respiratory infection, with those who don't have symptoms, is that you feel comfortable with them. So, of course, if somebody has a runny nose, is coughing, you give the person some distances so that you don't get infected. But in case of those without symptoms, that's not usually the case. You talk more with them, you move closer, even if they are not sneezing, they are still ejecting the virus or the bacterium, in this case, from their mouth, from their talking. And as you can see, what is written here is that the respiratory droplets is actually generated by shouting, coughing, and talking also do that, but you need to be at a particular, very close distance to the person before talking can actually lead to transference of the contaminated respiratory droplets. So, okay, treatments and prevention. The treatment and prevention of sore throat is actually very straightforward. Of course, the prevention is very straightforward. You avoid overcrowding. You have good ventilation, especially if somebody is within the house is coughing. And then, of course, there's no vaccine for now. And the major stuff I need people to look at is what you can use in treating them, in terms of the treatment. The penicillin can be used, and or erythromycin. Now the issue is, please, penicillin. We are still going to talk about penicillin later. Penicillin, please don't just use penicillin. Don't use penicillin. It's not as safe as. You need to get yourself tested if you're not reactive to penicillin before using it. But of course, erythromycin is much safer drugs for treating strep throat. But okay, let me quickly talk about this. We have what we call post-streptococcal sequel. Now, these are complications. These are complications that can occur after strep throat or other streptococcal infections. Now, the issue with this is that because of the interaction of this organism with the immune system can start overreacting, and it leads to bigger issues. Yeah, it leads to bigger issues. And well, I'm not going to talk much about it. So I'll just say let's go through the should I call it the list of what's I think it was listed there. Okay, it's around this area. Now, the late complications include glomerulonephritis. Glomerulonephritis, that's a kind of reaction to the kidney, where the glomerular, I've forgotten, the glomerulus is affected. Then we have rheumatic fever. We have neurological abnormality. Of course, the complications may subside, but it can also get into what they call it damage heart valve, leaks, then of course even heart failure. But these are extreme cases anyway. So okay, this what can I call it? The summary of everything about streptococcal pharyngitis. Of course, we've spoken about the way it is being transmitted, and then with the treatment, we said 10 days of penicillin or erythromycin, and then how to prevent it. You avoid crowd, and like we say these days, you use your nose mask. If you're going to avoid, if you can't avoid crowd, you use your nose mask, and you're very particular about what you eat. Then okay, there's something here that is added: daily penicillin to prevent recurrent infection with those with history of rheumatic heart disease. So this is basically stuff about streptococcal pharyngitis, and also about it's like an intro to respiratory infections, and over time I will hope that we'll be able to do better and find a way to give better presentation. Like I always say, we are still evolving, we are always evolving, and we hope to see you on the next mini-series. All questions will be attended to at the comment section. Thank you very much, and good morning to you all. Cheers.